Good morning, everyone. Bonjour tout le monde. My name is Dr. Judy Forrester, and I'm the chair of the board of the Canadian Chiropractic Association. I would like to begin today's announcement by acknowledging that we gather here today on the traditional unceded territory of the Algonquin Anishinaabe Nation. The Algonquin people have lived on this land since time immemorial, and we pay respect to their deep connection with this territory, a connection that is both ancient and everlasting and evolving. The Algonquin Anishinaabe Nation has a rich history that predates European colonization. Their traditions, languages, and culture are shaped and have been shaped by the rivers, forests, and land that constitute what we now know as the Ottawa region. It's important to recognize that this land has been a site of meeting and exchange amongst Indigenous peoples for thousands of years, including the Huron-Wendat, the Haudenosaunee, and the Anishinaabe. We are grateful for this opportunity to work, live, and learn on this territory in mutual respect and gratitude. May our actions contribute positively to the journey of reconciliation, and may we always remember the significance of the land and the water beneath our feet. I now turn it to the Indigenous Chiropractic Caucus co-chair, Dr. Jennifer Ward.
Thank you, Dr. Forrester. Walda asin, tantal bigisin waladat giskuk, walaliok tantal pe tayo. Begizin giskuk, beje gunawa dalok tan kohay, lugawahanam, edel lugawadam. Adel bokshik, gnuda masiran delial nuisin migamawie. Meske mumugwal nagwal, olnuia glusoan geduan. Nindalawisin Jennifer Ward, aknina migma. I'd like to start by saying I am here today to represent my family, my ancestors, and all my relations. Nogama. And I thank you all for being here today. Walaling. Today marks a significant milestone as we inaugurate the Indigenous Chiropractic Caucus, a visionary initiative crafted by Indigenous chiropractors and the Canadian Chiropractic Association, an association that represents almost 9,000 chiropractors across Canada. Our mission together is clear: to seek to understand the unique healthcare needs of Indigenous communities across Canada, a mission that is rooted in decolonizing existing structures, compassion, and the pursuit of equity. Our journey begins with an acknowledgement of the challenges and disparities in healthcare that Indigenous people in Canada face due to the devastating impacts of colonization. These disparities go beyond numbers. It's a reflection of deeper issues in healthcare accessibility, cultural sensitivity, and equity. We understand that the social determinants of health are rooted in political, economic, and social inequities in this country, and we commit ourselves to do the important work that needs to happen to achieve true reconciliation. A pivotal moment in our shared history was in the early 2000s, when the federal review of the NIHB led to the removal of chiropractic care from the NIHB program. It was gradually implemented over several years, but this decision significantly restricted the availability of non-pharmacological treatments for Indigenous peoples, creating a gap in holistic and culturally attuned healthcare. And now with that, I would like to pass the mic over to my friend and colleague, ICC co-chair, Dr. David Peeace.
Thank you, Dr. Ward. Anin, Nanabujo, David Peeace, Nadiskas, Manakadoram. The information of the ICC is significant stride towards addressing the challenges. Our aim is to bring together Indigenous chiropractors, professionals, develop resources, and tackle health inequities faced by First Nations, Métis, and Inuit people. Our focus extends beyond providing care, aiming also to promote chiropractic as a career of choice among Indigenous peoples. Our approach is comprehensive and holistic. We recognize the interrelation of physical and mental health. The higher rates of poor mental health and anxiety in Indigenous communities are critical issues that our mission seeks to address. Our aim is to provide holistic care that encompasses both physical and mental well-being, recognizing the unique needs and cultural context of Indigenous communities. We're also honored to mark this historic initiative with an official signing ceremony on Parliament Hill, and we do so with hope, determination, and shared vision. The event is not just a procedural formality. It's a commitment to a journey of healing, understanding, and mutual respect. It symbolizes our collective dedication to health equity, respect for Indigenous sovereignty, and the integration of traditional knowledge in healthcare. This initiative is a new chapter of our healthcare system, a move towards rectifying past errors and building a more inclusive system. It's an opportunity for all of us to contribute to a narrative of positive change and wellness. Your support and involvement are critical in this journey. This ceremony is a symbol of our commitment to partnership that respects Indigenous sovereignty, promotes health equity, and recognition of values of traditional knowledge and contemporary healthcare. I now turn it over to the CCA CEO, Dr. Ayla Azad.
Thank you so much, Dr. Peeace. I want to note that this initiative exemplifies chiropractors' dedication to fostering inclusive and culturally sensitive healthcare solutions. By uniting the strengths of Indigenous communities and chiropractors, we embark on a journey that respects tradition, embraces innovation, and addresses healthcare disparities. Thank you for being a part of this historic moment. Your presence and engagement are invaluable as we advance together in unity and purpose towards a healthier future for Indigenous communities and all Canadians. We are open to questions now or for interviews later in the day.
Thank you.
Thank you for having us here. It's a historic moment for us, and we're looking forward to all the collaboration that we are going to have today with our policymakers, MPs, and it's a privilege and honor to be here in Ottawa. Thank you.